Hello. Happy Tuesday. I know. Where's the theme song? Well, guess what? We have a new theme song. And this is the first time I'm going to hear it. Erik and Susan worked on it. Thank you, Susan Murphy, for doing our theme song once again. I can't even wait.
Oh, my God. It's so good.
So here's the Laura Cain After Dark official theme song. Go.
Are you ready?
I am so ready.
Let's count it down.
Okay. By 3. Not 10. 3.
No, let's by 20.
No.
Okay.
3, 2, 1.
It's Laura P3 Posse.
Ooh, that is very sexy.
Isn't it? Well,
I like it.
We are after dark.
You know what? That's catchy too, because I can just, my mind tonight, I'm going to be like, Laura Cain After Dark. Laura Cain After Dark.
Good?
She's so good.
She's so
Did
good
she
at
do
that.
that with GarageBand again? I mean, whatever she used, it was amazing.
I know. No, I don't know what it was. I watched her do it.
You did?
On Zoom.
FaceTime?
Yeah, on FaceTime. It was awesome.
Oh, wow.
Yeah.
Thank you, Susan.
Thank
That's
you,
super
Susan.
fun.
We love you. You're so awesome.
What's going on? Happy Tuesday. I'm Laura Cain. Hold on one sec. Oh.
No, I'm not right now.
Not now?
Not yet.
Erik had to tell me a secret in the middle of the introduction.
Sorry, I know. I couldn't help myself.
When would you like me to ask that question?
In like a minute or so.
In a minute or
Yeah.
so.
We'll
Okay.
get through our...
Okay. I'm very excited because Monique from Jolla Cosmetic's coming in to talk about us. New you, 2022, new you. What's going on? What's new? What can we get done this year to make us look hot? Monique is here,
How
and
are you?
I'm going to give her your mic.
Okay, great.
Okay.
How are you?
I'm good. How are you? This is so fun.
So, Monique, this is Erik. Erik, Monique.
Good to see you in person.
She's like the PR front man for La Jolla Cosmetic.
Yeah, I'm technically the chief community officer.
Oh.
Doesn't that sound fancy?
Chief CCO. CCO.
CCO, yeah.
Ooh, I like it.
Yeah.
So I thought it'd be great. I'm out of breath. I ran to get you. That's not
she came
sad.
Running down and wait, it's okay.
It's sad. That's how little I work out. I'm like totally out of breath. So I wanted you in here so we could talk about like 2022, new you, new beginnings. What kind of things are you guys like introducing this year or continuing or just talk about stuff? Anything interests me with cosmetic surgery. Anything.
Well, and I'm the same way. I'm like the first to volunteer if they need a crash test dummy or something, like I'll do it.
Take me.
I'm happy. So we, as you know, that you've been at the center, we have 2 offices. We have the medical spa where you can get things done without having surgery, and we have the surgical center where you come in and we have ORs and 5 board certified plastic surgeons, and you know that.
I know number 1 floor and I know the 3rd floor. I know both of them very well.
2 floors in the same building, and so really it's wonderful because you kind of have the whole world at your fingertips. And so some people might say, I really hate my neck, but I have no idea what to do.
Oh my God,
where do I start?
That's my next thing.
And I think it's the next best thing.
It's
right?
my next. That's something that's really bothering me lately.
And so I think it's one of those things where, sometimes you might have heard from a friend and they got a neck lift or they did the cool sculpting under your neck, or you might have heard something, but maybe you really just don't know what it is that you need. And so you can start, whether you start in our med spa or you start with the surgeons, and just show them, what bothers you, and they can help direct you because, it's either way to us to have you get what you're looking for, accomplish your goals, whether it's, and sometimes it's people, whether it's in their timeline, maybe they don't have the time for recovery. So something that's non-surgical might be better. Or maybe they say, I don't want to have to repeat this in a few years. I'd rather just be done. And, like we do a lot of thread lifts in
I can't wait for you to talk about threads. Do you know about threads?
No.
You don't?
Threads are amazing.
They really are.
So they're great for people who are starting to feel like things are getting lax. but they're maybe not ready for surgery. Okay.
Okay, wait a minute. I just turned 55 on Saturday.
Oh, I just turned 54 last week.
Happy birthday.
Happy birthday, Capricorn.
Yes.
Yeah,
What day was
Capricorn.
yours?
I'm the 25th. I'm Christmas Day.
Oh my God. Happy.
So it's been actually a couple
Yeah, mine was the 8th.
Yeah.
Okay, so I'm deathly afraid of surgery,
Okay.
but I kind of want to get the fat under my eyes taken out.
So
Can you do
that's
that
a
with threading?
No.
Can you thread my eyelids?
Well, actually, yes and no. So, but I'm looking at you, and I think because you've got a little puffiness, so I think that's something where it's more the fat pads underneath, so they kind of have to go in and take them out. But it's a super easy surgery. Okay. Yes, upper and lower eyes, and that makes a huge difference. That's like the best bang for your buck, I think, in the surgical center, and to make you feel refreshed and renewed, and it's going to last a long time. It's very easy. So a friend of a friend that I recommended just came in. So I'm at this friend's party on Saturday night, and we're outside and we're talking, and this lady's talking and telling me her name, and we start saying something. She goes, "Oh, where do you work?" And I say, "Oh, La Jolla Cosmetic Surgery Center." She's like, "Wait a minute." And she takes her glasses off. She just had her little readers or whatever. And she's like, "You're the one who referred me to Dr. Smoot to do my eyes." And she had just had them done 2 weeks ago. She said, I did not take one pain pill. Not one.
Wow.
She looks so good. It's only been 2 weeks. And she's so happy, and she's going to be set for years. Now, there are some threads that can go under the eyelids, and I think depending on, I'm not the expert on this, but sometimes they can help smooth out that area. But if you have a lot of extra skin, I'm not saying you have, but for your listeners, if you have a lot of extra skin or some extra fat, it's probably going to be surgery, but that surgery is very easy.
Do you take it? Do they take it out, or do they suck it out, or what? Is it a lipo thing?
No, it's not a lipo thing. But they actually can go in from the inside of your eyelid to take out the fat pads. Let's pretend it was only fat that you needed taken out. A lot of times it's skin and fat, so the incisions right along your eye, the ridge of your eye. And on the upper lids, it's the same. It just goes right into the crease, and they kind of blend it out a little bit. And so she was only 2 weeks after surgery, and one side was a little bit red still. You didn't even know. I couldn't even tell. She didn't have makeup on either. So she could have easily, when she took off her glasses and I could see it, I saw a little bit of red, but not. It looked.
I bet she's
almost
so
like
happy.
eyeshadow from far. But it's great for men because you heal quick. And it's that one thing. I think it's like on your face, it's the eyes and then the neck.
Yeah.
Or the pre-jowls, whatever they call it.
Because I'm scared to death that I would look like Kenny Rogers. That's one of the reasons
I'm not
I'm
going
so
to pull
terrified.
anything. They're just going to take out the fat pads.
And take out this. If there's extra skin, they can. There's a lot of little things they can do in there. But it's, sometimes when we see celebrities, it's the ones who've done it 4 times or 5 times. Yeah. It's not the everyday person like you and me, where we go in, we get something done maybe once and then we're done, or we go back later and have, somebody might have a face and neck lift and 10 years ago and then do some threads now for maintenance, or 15 years ago. Or you can reverse it and do threads or something that's non-invasive, like fillers or a combination or lasers, and then kind of make Mother Nature wait a little while, because you're maybe not ever ready for surgery, or maybe you're thinking, well, what can I do now that isn't a full surgery, and put that off for another 5 years or something.
What can you tell Erik about not being scared about surgery? This is why you should be afraid.
Well,
it's not that I'm afraid of surgery. I'm just afraid of looking like Mickey Rourke or Kenny Rogers.
So I think the best advice for that is two things, but really looking at before and after pictures. That helps you gauge what is this person, this normal person from the down the street, and here they are before, here they are after, and looking at a lot of different photos of different people, and look at the surgeon's work. And I will say, it is important to look at before and after photos on people's websites, because, we look on Instagram, we see a bunch of stuff, but we don't know, all of us don't know, is that photoshopped? Is that has the person made, if the doctor takes the before and then the person posts their own after, how do you know that they didn't alter it in some way? And so it's really important that, the lighting's the same, the distance is the same, the angles are the same. You know, if you were trying to get a profile and look at somebody's neck, if the before they're like facing straight ahead and the after they're tilted up just a pinch, that's enough to stretch the neck out and make it not really a legitimate after. So but I think that's the best way, and that's for any procedure, whether you're talking about something in the med spa or you're talking about something surgical, you know, especially with breast procedures, because breasts are all different shapes and sizes, and some are more tubular and some are more droopy and round and more, you know, some are more wide set and some are more close set. So looking at a lot of before and after photos helps you find maybe somebody who's built like you, who maybe has a shape like you, and then seeing, okay, what did that look like after a, you know, 350cc implant or whatever they end up having. And so we try to have that on our website in the gallery where you can filter by different types of procedures. And if they know the information, they'll say, you know, this 45-year-old woman had da, 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 and then you can read and see, you know, what exactly.
So you have lots of photos on the website.
Lots of photos, and then even more photos when you come in for consult, because some people
You guys take a lot of photos in the beginning, like before you get stuff done, which is great.
Yeah, because you can't get your before again. You know, if we were, heaven forbid, were to miss the before photo after surgery, you can't go back.
You guys have a lot of before photos of me.
But there is having the before photos, and then at the consult, when you're meeting with the doctor or meeting with the provider, sometimes people will give permission to show their photos to other patients during a consultation, but not where it's up on the web. So there's sometimes, if you don't see it on our website, that you're not really finding maybe a certain kind of procedure that you're like, well, they don't have very many results.
Do you have breasts on the website?
Yep.
Are my boobs up there?
I don't know.
Oh, maybe they are. Because the picture is just from the neck down.
I have no idea. But they should be soon.
I wonder if somebody will pick my boobs. That'd be awesome.
Your boobs are great.
Thank you.
So having, you know, so when you have that consult, then the doctor might have other photos at their disposal where the patient has given authorization to be used in a consultation and show that, but they maybe just don't want it up on the website. So.
Erik, I think you should do that for yourself. Well, I honestly think you should.
At least talking to somebody and kind of finding out what are your options, because you might have multiple options, or they might say, really, this is like ABC. Here's how long it's going to take to recover. Here's how much it costs. But I think the fear of looking overdone is a valid one. It's very valid. And, you know, that's where that looking at before and afters, you would know if a surgeon is overdoing it, because you would see that in their photos. Yeah. Right? You'd kind of go, they look a little tight. And of course, right after surgery, whether you're having breast, whether you're having, you know, any kind of facial work, there's swelling. And even body work, you know, if you're having lipo, you're going to be bigger after surgery than you will be afterwards, because you're holding a lot of water in. There's a lot of, you know, your body, when there's any trauma at all, even little trauma, it's, you know, it compensates by having some swelling. So I think people who have facial surgery, like facelifts, brow lifts, neck lifts, you know, there's some swelling, so the skin is a little more shiny and tight right at the beginning, and not gooey. You know, like if you touch your face now, it's like pliable, and I know gooey's not the right word.
I was feeling that.
Makes sense. I was listening to Glass Animals on the way over.
I love that song.
The gooey song, so of course it's on my mind. But so at the very beginning, you will be tighter and puffier then, but it's not to worry. And we do show a lot of I think you talked about that, Laura, some progression photos. Like here was the person at a week, here's the person at a month, here's the person at 6 months, and how that normal course, because the more you know about what the healing process is going to be, the easier the healing process is.
And they're so good at Laura Cosmetic, just walking you through the whole process, explaining every detail. I mean, it was explained to me so perfectly. I had no questions at all. And like you said, I looked at the photos, the progression of this one woman who had her boobs done, and they were a little high in the beginning. But as the months went by, they were low, low, low. And then they just looked so incredibly natural. I'm like, and mine have gone down a lot.
Some time. Yeah, it takes some time. And And that's the same. I would think even if you're having, let's say you go in the med spa and you're having a laser procedure, or you go in the med spa and you're having, lip filler, you're going to be a little more puffy for a couple days. It's not going to be weeks worth, but, or lasers, you're going to take some time to heal. You're going to be more, red or like looking almost like you had a sunburn than you will 2 weeks later, 3 weeks later, that kind of thing. But we do try to prep you really well for what to expect, because I think that is the thing that, just like you, it's like, well, should I even call because I'm afraid of X, Y, or Z?
Yeah.
They have such an easy hand at La Jolla Cosmetic, not a heavy hand, an easy, steady hand. Like I've never seen anything from La Jolla Cosmetic that looks overdone.
Thank you.
At all.
Yeah.
'Cause
It's
I want
also
to be able
natural.
to blink. I want to look like
You will blink. You will be able to blink.
Yeah. This is important, and this is something is what, like this girl that I had only know through my friend, and I didn't meet her till 3 days ago. But I was, I felt really comfortable saying, here's who I would recommend, and here's why, because you don't want to be overdone. You can always go back if
True.
Let's say if your skin tone, I mean, everybody's skin is different, but if later you see like, oh, it just seems a little bit loose still, they can always take more skin. It's hard to put it back.
Right.
Yeah.
So that's one of those, I think it's better when doctors, are on the cautious side, really.
So what is threading?
Yes, because we have
Okay.
filler, we have Botox,
And
now we have threads are
And
exploding.
the threads are exploding. And so threads are not new. And we have a podcast. There's a couple that talk about it, but we are the number one Nova Threads provider in Southern California. And we have the number one person whose name is Cain, and he does the most threads in their whole portfolio, and he does training. So threads are actually suture, like resorbable suture that they might use to close a hernia or a tummy tuck, or so it's suture, and it's in a little cannula, so it's in like a long hollow tube, and so they numb you up first. And let's say you're doing your mid or lower face, like most people, like me. I'm ready. I'm like, can I go in? Does anyone have time to help me out? So they kind of come along, but so they would make some incisions.
Sorry.
They would make some incisions to get you numb. And then once you're numb, then they would insert that cannula in and the thread's in it. And then they pull it out and the thread stays. So it's just a way to get the thread in there, basically. But there's different kinds of threads. There's barbed threads, so they sort of have like little teeth. So if you think about the smooth side, it goes in the smooth way. And then when they pull it, it's going to attach on and pull.
Don't be
inside.
scared.
It doesn't hurt.
Yeah, I've had one done. It doesn't hurt at all.
No, it really doesn't hurt. I've had them done.
Are
I
you
had them
awake?
done.
Yes.
Yeah,
you're just
awake.
numbed up on the side. Do you see immediate results?
You do. And that's something that's great with threads. So threads is sort of, you get a benefit immediately and it gets better over time. What happens is when your body sees that's a foreign object, right? So that thread is not part of you normally. So your body goes in and over 6 weeks, that suture will resorb and go away, dissolves. But your body goes in and it stimulates collagen production. So they have little twisty ones that do one thing, and they have barbed ones that pull more. So they have all these different kinds. So don't ask me about
Give
all
me
of
the
them.
barbed ones, baby.
Yeah, but there's all these different ones to do different things. So sometimes maybe they're trying to help you with an area of your face that might be depressed a little bit, and they can put some little spirally ones or whichever ones help stimulate collagen or to help with scarring, and then maybe the barbed ones you're trying to pull. But Cain had a really great way to help you understand how would you know if you're a candidate for threads or you need a facelift, let's say if we're talking about the face. If you can take one finger and put it wherever you want, whether it's your knee, I mean, they can do threads everywhere. If you can do one finger and it makes enough of a difference for you, then threads would be appropriate. If you have to take your whole hand and pull to really get what you're looking for, then maybe threads are not going to be it. So
Something more.
So if I was to do this, like right
He's
now,
pulling
I
his
look like a
face.
Shar-Pei, right?
he does not look like
I know he doesn't.
Yeah. See, I feel like that's
So he would just need threads. It doesn't look like you would need a full bottom facelift or
and
anything.
when they put the threads, so when they do their little plan, they've got like, they put a whole bunch in. And I think Cain did mention, he does training all around the United States. And if you were to Google threads, you might see people who are like, oh, it's not worth it. Don't waste your time. Don't waste your money. Well, there's a lot of places out there that'll put maybe a third of the amount that you need to get that result. So you've got to really look again at the provider. It is provider dependent because their, and their expertise is important in this way. It's not, just something that doesn't matter who's putting it on you. Like, even there's an art even to cool sculpting where that's that machine is doing the work, right? But what kind of applicators do you use? Where do we place them? There's all these different shapes of things that, this one's better for arms and this one's better for here and there. And so, provider expertise really does matter, even on things that we might all, as lay people, think of as, not technically important or not, I don't know, what's the right word for, you think, it's just a med spa thing. So it's probably the same here as it would be 10 miles down the road. But a lot of these things are very provider specific, and you want a provider who's been doing it a while and has done hundreds and thousands of them. So the podcast that dropped last week,
their podcasts drop every Tuesday. La Jolla Cosmetic has a podcast every Tuesday.
And it's called the La Jolla Cosmetic Podcast. So last week, the one that came out was about 2 ways to combat cellulite.
Ooh.
And Cain is the one who's talking about it. And we talk about Selfina, which is it's a technology, I guess is the right thing to call it. We have like connective tissue. If you think of and he talked about Roman columns, so women are different than men, and men don't get cellulite as often. And he explains why. But it's like those columns are tight and then the fat kind of pooches up. So you get these dimples and puffs. And so Selfina goes in and it's sort of cutting that tension, the band that's pulling down, that's creating the dimple. Well, what he also does then is uses threads to help augment the result. So say you can do Selfina, maybe we'll do the dimples on your backside, but maybe you have, you think about, well, what about the front of my thighs? That's cellulite, and maybe it's not, maybe it's just loose skin.
Mm-hmm.
And then he can use threads to pull up on.
Like how many threads are we talking?
I don't know.
Oh, you
That's
don't know.
That's a good question.
Okay. But quite a few.
Yeah, you probably. And then there's also one other thing that he talked about on that, which is an injectable called Quo, which is QWO. And that is where he can, say you have your Selfina, that really targets most of it, but say after the healing process, you've still got 2 dimples. Then he would use Quo and inject, and it dissolves that band. Instead of manually cutting it, it dissolves it. But it's something that, you want to have like a month or so before you want to hit the beach in your thong. You want to have that. So this is the perfect time. This is the perfect time of year. You're talking about new year. What do this is a great time of year for body contouring. So if you're doing lipo, we do the 360 lipo, which is all the way around your whole trunk, basically.
Oh, wow.
The HD lipo, which is the high definition lipo.
What does that mean?
So where you can get like a 6-pack. You have to go check out these photos.
Oh my
amazing.
gosh.
So Hector Salazar,
I know
he
Dr.
is
Salazar.
our resident expert in the high definition or HD lipo. And so you just get that like 6-pack or 8-pack. I don't know how many packs you have. I'm not a man, and women, maybe they want definition too, but maybe not in the same way that a guy does, or like the V along the front.
Oh, I love that V. I love you.
And
Eric, do you have a V?
Uh-huh.
Oh,
and there's
boy.
a back V too. Like there's that, and so you can go and you'll be able to see on the before and after photos really like how they can really contour the body.
Let me tell you, that back V is hard to get.
I know, and it looks so good.
It does, yeah.
It looks so good.
Yeah, it does. And so, and then the 360 lipo, Dr. Swiston is the one who's really kind of the person who does probably the most of the 360. And that really is just all the way around. And we do have a podcast about that too. I think now we've got like 34
Wow.
episodes. So all of a sudden, now we have this library. There's a lot of really good content in there. I've learned so much, and I've been there for 30 years, literally.
Oh my gosh. Wow.
30 years.
Isn't that
But
crazy?
I keep learning new stuff as I do this podcast that I had never known before. So I have a lot in my head of what things can do and how, long things take to heal and that kind of stuff. But I still keep learning new things. And I think that's a really great way for if you're thinking you might want to do something, it's without even having to ever come to us in the first place. You don't even have to make a phone call. You can just go listen to the podcast and then see, how, if you want to proceed to the next step.
How do we get the podcast?
So it's on all the places you get podcasts, and it's called the La Jolla Cosmetic Podcast.
I have a question.
Yes, sir.
What is like the tier pricing for threading?
I think they do it by, that's a good question. And we have all our prices on our website. Oh. So
Oh, that's good.
And sometimes it's a range because
right.
Who knows exactly what it's going to be for you when you get your quote, but at least to get an idea. So we have all our price ranges on the website. It's very transparent, and we've always done that. I think it saves everybody a lot of time.
Mm-hmm.
If somebody's calling us and they make an appointment, they think liposuction's $500. That's a waste of their time to even come in for a consult. It's a waste of the doctor's time. So we want to help prepare everyone for kind of what you might be looking at. And then when you have your consultation, we give you an actual quote, a written estimate, so you know exactly what you're dealing with. And we work with financing companies, and that's good. But if you're thinking about, let's say, threads, I think they have sort of a price for the, let's say, the lower face or the mid face or the brow. I think they kind of carve it up into body sections. But I don't want to misspeak because I'm not.
So
exactly
it's on the
sure.
website. That's
But
great.
it's on the website,
Okay.
and so every once in a while you'll see something that might say call for pricing, where it's almost impossible to give a range. But almost everything we have a range, and then we have a membership club that we've now been doing for maybe 12 years. It's called the Glam Fam.
The Glam Fam.
The Glam Fam, and so
That's the website, right?
and
Glamfam.com.
glamfam.com. Yep. And so our Glam Fam is, I guess, and people hate it when I explain it this way, but to me, it's the easiest way to understand it. It's sort of like Costco. You pay your fee for the year, and that allows you to shop at Costco. So the Glam Fam, there's a yearly fee, and then that gets you the best pricing on everything, whether it's products, whether it's services in the med spa, no matter what, it's going to get you the best price. And when you, like Laura, you had your surgery, you get Glam Fam free for a year, because you had your surgery. So you started downstairs, and then you're going to go, if you go to the med spa. But we guarantee that if you don't make your money back, and it's $120 for the year, most people will make their money back in either 1 to 2 visits. It's definitely the best way to go, because then you get package pricing. Like, say you're going to do cool sculpting, or you're doing threads, anything that you're doing, where you might have multiple sessions. Like in cool sculpting, maybe you want to do your love handles, but you really need 2 sessions. So you've got 2 applicators, 1 on each side, 2 sessions, that's 4. And then maybe you say, okay, but I want my, mid-abdomen also, and that's maybe 2 more applicators, and that's twice. So all of a sudden you might be at 6 or 8. Well, we give a package deal to the Glam Fam members, so you get a much better pricing.
That is just so. It must be like a kid in a candy store.
I am all the time. Can you tell I'm like
Yes.
not at all excited about
Oh my
it?
gosh, you are. I would be the same exact way. I love all this stuff. I love it.
So if I was Laura's husband and you had a Glam Fam membership, does that apply to just one person?
It's just that one person. Yes.
You'd have to be a member too, hubby.
Okay.
Honey.
But it's worth it.
Yeah.
I mean, and like I said, if it doesn't pay for itself, we'll give you your money back. But I don't think that's ever happened in the 10 or however many years we've been 10, whatever, 12.
What kind of surgeries or things are men getting done these days?
So
What do you see a lot of men
Yeah.
doing?
Men, so eyes, just what he asked about. That's one thing that men do a lot. Lipo, they will do a lot of liposuction because it's
It's hard to lose that.
the love handles,
Right.
and no matter how fit you are. Now, if you're a guy who has, you're overweight, but you have like the beer belly that people talk about, and it's tight, that's going to be pretty hard to treat with either cool sculpting or lipo because that's fat that's around your organs. That's intracavity fat. But if it's subcutaneous fat, like the kind we can grab, then that's the kind that is really good for lipo. And so the doctors will, if you say, yeah, I'm really at this weight, I've been at this weight for a long time, I'm pretty happy with it. And if you're within 5 or 10 pounds of your weight that you like, but you're like, I just can't get rid of this part, or when I swear this is so embarrassing, but so I love to go to USC football games, and when you're a woman and you like wave that pom pom,
my
and then
gosh,
you're doing the pom pom, and then like the
Flappy
arm
flap.
is flip.
The bingo arms.
Bingo arm.
Yeah, so certain things are not going to go away no matter how much.
I mean, you'd have to take skin off to make that go away.
And this is the thing. And we actually just recorded one. I don't know when it'll drop, but we just recorded one about massive weight loss and what people do who might be if you're losing maybe 100 or 150 pounds, what happens to the skin, no matter what age you are. But anyway, so I think it's one of those things where, so for men, getting back to men, another thing, so maybe men do think about this, but they don't talk about it, is their breasts. So
boobs, boobs.
And men, so it's sort of hormonally driven with young men. So, and sometimes that is a hormone issue. But in older men, I think it's like 60% or something of men have what they call gynecomastia.
I heard it was caused by pot smoking.
Really?
I don't know. I heard that one time that if you smoke pot a lot, you'll get man boobs.
I wonder if it changes your hormonal balance.
I don't know, but I've seen that before.
Or they're just hungrier and they eat more.
Yeah,
I don't know. But anyway, regardless, they can take skin out, they can liposuction, they can kind of do a little bit of both. That's such a what's the word? Like gratifying. Yeah. Because a lot of guys are just too embarrassed to take their top off at the beach. They don't want to remove their shirt. It's like the guys who are losing their hair, and that's another thing that we do.
Oh, yeah, Dr. Salazar, right?
Dr. Salazar does hair restoration, both non-surgical and surgical. But it's one of those the guys who won't take off their hat. Well, I get it. There's a lot of us women who don't like our arms, and we don't take off our jacket either. So, well, there's always ways to fix things. But that's something that I think men, we do. It's not like we do a ton of it, but there are a lot of men who that's an area that they're a little bit embarrassed about, and they just want to feel more confident. And I think that's at the end of the day, what we do is we help give confidence. We're helping our tagline or 100%. Our brand promise is making dreams become real. And, like you had a dream, you've been thinking about it for years, and then all of a sudden it's been done. And,
it is just.
But I think it's really, it comes down to confidence, right?
Oh,
so it's
yeah.
Like, when you put on a great dress or you put on a great outfit and you look good, you kind of have your head held high, your chin up, you feel like really great when you're walking in somewhere, or you just get your hair done. It's kind of like that, but you're wearing that procedure in a way, and it becomes part of you. And I think you said that.
It does.
Day.
Like I don't even feel like. Well, first of all, I don't feel anything, and I don't even feel like I ever got anything done. I feel like I've always had these boobs, and they have always been this size, and my skin and the texture, it all fits. It all worked out, and it looks
cool and
100% real.
And of course, at this very same party that I was at, I talked to another lady who had gotten breast implants, and she's at a point in her life where she's like, I just got them, and I got them way too big. I got them after I had my kid, and and now I've had them for 20 years or 25, and she's like, and they're not me anymore. And so there's a lot of that too. So we have a lot of people who, want to go bigger. But then there's a lot of people who maybe want to change out their implants for something smaller. Maybe they want to remove them completely. And that's something that we do as well, because you do change in life. What's important to you when you're 23 is different when you're 50. Yeah.
Sorry. That was my next question to you. Do you see in the environment that you're in, like kind of trends, like as clothing, like where, years ago, like the porn star boobs, so the thing where
Yeah.
every woman wanted
It
these
was like, go
huge
big or
boobs.
go
Yeah.
home.
And now kind of with the Kardashians and Nicki Minaj and all this, all these women want these huge butts. And so do you guys see that?
For sure, trends, and I think social media has only made it more so just because we all have access at our fingertips to see a whole bunch of stuff all the time. But really, those people are just the 0.1% of what normal results are. And that's why I go back to that looking at before and after photos, because that's sort of on the far end of what
It's almost
anybody
freakish.
wants.
Right.
Yeah.
It is
And
almost
there are
freakish.
people who want that, and go for it. But really, 99% of all of us just want to look better.
Better.
We want to be us.
Right.
We just want to be a little enhanced.
Yeah.
So I don't know if you can talk about this or not, but I'm going to ask this question.
Oh, God.
Here we go.
Do you have people that come in where you're just like, no way, we're not doing that?
Yeah, there are people, and it's not. I don't know. The doctors would be better to speak about maybe the percentages, but you hear about body dysmorphic disorder, people who think that they're overweight when they're really thin, or people who think that they just need more of something. And this happens in the med spa. And actually, I spoke with Julia last week on the podcast, and I think her episode might drop tomorrow, where we talked about lips. And this is, you start to see some of these women and you're like, what happened to their face? Because their lips are huge and they look, they behave strangely. Like when you watch them talk, you're like, what is wrong with her mouth?
Yeah.
Or you see them from the side and it looks really weird. But they kind of lose perspective of what they should look like and what a normal result is. And if you go to a place that just says yes to you,
Right.
that's a dangerous thing,
Oh,
because there's
my
a lot of
gosh.
places that'll take your money. And that stuff doesn't go away. She talks about it. It can stay, even though, let's say, one of the products is, on the box tells you it's going to last for 18 months. That doesn't mean it's all gone by 18 months.
Right.
I would have thought that. I would have thought, okay, it means it's time for more. But it doesn't mean you could still have residual 5 years later.
Sure.
It's not going to be the same amount, but in some people's metabolism, you eat it up faster than, or where it is placed, your mouth, it moves a lot. If it was under your eyes, it doesn't really go anywhere, But I think going to a place where they're not going to just take your money and they'll tell you no.
Right.
And I went in actually to get some Botox, as I do.
As we all do. Well, not
we
Eric,
like
but
to
soon.
know. And I was talking to the provider, and she's like, what is wrong? And she was sort of like looking at my eyelids, and she's like, what is wrong with your eyes? They're all puffy. I said, I know they're really puffy and they've been kind of weird looking. And I think I just need an eyelid lift. It's that time, right? I'm 54 now. And she goes, I don't think that's what it is. Did you ever have filler under your eyes? And I was like, yeah, but like 5 years ago. And maybe before that, 10 years before that. I mean, really, it's not very much. She goes, I think it's migrated or something. And sure enough, so she used the hyaluronidase, which is a dissolver. So
Yeah, you can. If you get too big of lips, you can dissolve it down, right?
And she said, I don't want to do anything until let's see if we can get rid of that. By that night, they had gone down, and we've done one more session. So like we're kind of getting me back to baseline. So then she wants to do some threads under there to see if, because I don't really think I have a ton of excess skin.
You
but
don't.
It's, a little more hollow and not perfect. I'm not ever going to be perfect, but if we could like make things a little better, or like where the shadows hit you, that kind of thing.
Oh, yeah.
But it was, if I'd gone somewhere else, they might have said, oh yeah, let's
Stick some more in there.
stick more in. Or,
Uh-huh.
And she's like, let's see if we can.
That happened to me where I said my eyes were kind of getting hollow. And I said, please just put some filler in there. And she was like, no, that's not what you need. You need actually a little bit down in your cheek, because we want you kind of want your eyes a little sunken in, just a little bit, or else it looks too weird with the cheek right up against your eye.
Yeah, and that's what you end up seeing. And I think that's what we all notice is
That's what we
if
notice.
It's a celebrity or somebody on TV and you're like, why is their cheeks are huge?
Yeah.
They're like huge, or their brow, or all of a sudden they've like grown something under, And so the great part about hyaluronic acid fillers, so like the Juvederm line, the Restylane line, and there's a whole bunch of products in those portfolios, but they're hyaluronic acid based, and that's a protein that's in your body that's naturally occurring, and it kind of helps bring water into the area. So when they, if it's not right, they can dissolve it, and it almost instantly goes away. And it takes some time for your body to clear it all out, but it really helps. We had
There's a fix.
We had a lady who had she'd been coming to us, and I don't know what made her. She was embarrassed, but she's like, I don't know what made me go somewhere else, but I did.
She cheated on you guys.
she cheated on us, but I get it. I get it. Your friend tells you something, or you find a Groupon or something. I mean, it's not the way I would go, but she cheated. She called us, and she's like, my lip is sort of bluish.
Uh-oh.
And the person had, I guess, injected the filler into like a vein or
Oh
something.
no.
Something. I don't want to misspeak on which anatomy part was, but it can be. It's not just like ketchup that's not going to hurt you. If it's not placed in the right spot or around the eyes. I mean, if they don't know the anatomy very well, you can go blind. It's a very slim chance, but you can't leave these things to chance. You want to go, whether you come to us or not. That's my big thing, is really about patient education. And I always, when people ask for referrals, I'll give other surgeons that are nearby that I know are also good. You don't have to choose where I say, but I want you to go somewhere safe where you're going to have that's reputable, and you're going to have a good outcome. And so, so they said, get in here. They did the hyaluronidase to get her circulation back, but she was losing oxygen to the area.
Goodness.
And then you can have skin dying, and then what do you do?
Oh, thank God she called you guys back.
Getting your lips, you're thinking, oh, it's just no big deal. Yeah. Well, it is. So, and those are really one-off. But in
plastic surgery, you kind of get cosmetic surgery, you get what you pay for. You really do.
And us being this close to the border,
yes.
So I had a girl who messaged through Instagram, and I'm the one who gets all the Instagram messages, and she had gone to some sort of filler party.
In Mexico?
No, she was here. Here's what's interesting. She was here. She's 21 years old, and she had a big bump in her lip, almost like a granuloma, like a hard thing, and it had been 6 or 7 months since the filler. Because I was thinking, if it just happened, maybe it'll go down. It was not swelling.
Like a blackhead or something?
It was I think it was underneath the surface, but she could feel you could see this little bump. And it was almost like if you had a pea under there or something, you had something under there, like a little rock. So I asked her what product did they use on you? And she told me, and I was like, I've never heard of that. So I'm Googling this product. It's not a product that's FDA approved in the United States. But what happened was, so she had the injection here, but the person brought it something that's not allowed in this country over the border. And that's something that I had never thought about until this happened. I always think about, people can go across the border. And
there are billboards everywhere down there for cosmetic surgery.
So that, so she's going to some house party, and she's thinking, it's only $250 instead of $600 or $700. And yet she's got something that's not FDA approved in her face. She's super young. She's now got this thing that might have to be cut out. It was just and so it's I think we have to be smart consumers about this stuff. That yes, it's fun, and we can do a lot of things that make all of us feel better. And I so encourage people to do what makes you happy. Don't worry about the haters. Just do what you want to do. And if you want to do it, you don't know anybody's explanation about why you're doing it or when you're doing it, or you don't even have to tell anybody. Just, you do the way you are. But be a smart consumer and be, savvy about, okay, I'm going to read reviews, and I'm going to read reviews.
You guys have a lot of reviews on the website.
Thousands. And they're from real patients. If you go on Yelp, and there's a lot of great reviews of us on Yelp, but you don't really know. Yelp isn't saying, were you really a patient there?
Sure.
Mm-hmm.
It's no big deal if you're talking about the Mexican restaurant down the street. Did you ever go to that restaurant? Well, that's not as important if you're reviewing the restaurant, if you really ate there, although it's important for them. But if you're talking about surgery, it could be a crazy ex-girlfriend who's mad. Who knows? It could be anybody who has an axe to grind. So you have to take so we have verified reviews. So all of our patients, after a consultation, we send them a survey, and it's actually a third party that sends the survey on our behalf, but it's all anonymous. So they are sending the surveys, and if the patient has had an experience that they're not happy with, it'll ask them, we contact the practice on your behalf, and so that we can make it right. We need to know if something didn't go well, or you waited
that's good
too
to
long
know.
or something. That's how can we get better if we don't know? We of course we love all the 5-star reviews and we love seeing happy patients, but when there isn't and things happen, then we want to be able to make it right, and we want to fix whatever it was. If somebody didn't get back to them quick enough, or you never know. But so we have thousands of reviews through real patient ratings, and then you can also look on Google or Yelp, or there's other places. So it's sort of taking the broad middle of all of that. So I think that's really important. And
God, I love everything you just said about you don't know anybody an explanation. Right. You don't. You do not. You have yourself to answer for. And that's why finally, instead of people saying, oh, in my life saying, you don't need a breast augmentation, you don't need boobs, don't get it done, that's dumb. I was done. I'm like, I want this. In my heart of hearts, wanted this since I was 12 or 16.
I hate to admit that, but that was me.
That's okay.
Every
I know.
time she said I was going to get boobs, I'm like, you're not getting boobs.
I know. And I'm like, you know what?
Well, and I think it's doing it for the right reason. You want to do it for you. Mm-hmm. You don't want to do it to save.
I didn't want to do it for you. Yeah, I want to do it for me.
Right. But for some women, there might be somebody who says, no, I'm feeling like my husband's losing interest in me. Don't do it for him. Don't do it because you think, he probably will be more interested in you. That's possible. But don't do it for someone else. You have to do it for yourself. You can't do it to please someone else. And I think that's, especially as women and as we get older, we start to get a little more insecure about things.
Oh, for sure.
And if you're doing it to make yourself feel better, great. But don't do it to try to save a marriage or do it, that's not really a good reason, because what if you get it done and then your marriage still doesn't work out?
Well, you'll look great.
You will look great.
You'll still look great. So what's the problem?
But does that make sense?
Yes, it does make sense.
I just think you have to kind of do some soul searching and go, am I doing this because I want it or because somebody else is telling me to? Right. And so if you do it because you want it, and even, I think us in the business, we do all kinds of stuff all the time. And I'll still have people going, why did you do that? You didn't need that. I'm like, yes, I did. Because I think I needed it.
Yeah.
And I wanted it. And that's something I did for me. And I think that's something that COVID has sort of taught us, as we are all stuck at home for a while. Well, we're on Zoom all the time now. We look at our necks all the time. It's depressing. But, and can we have the filter in real life all the time?
I know. Those.
Sure. If I could walk around with those filters on, let me tell you.
Yeah. So
that smoothing filter. I love that thing.
I know. I'm like, okay, we got to have that. But something it taught us is life is short, and we, if it bothers you, fix it.
Yeah.
And I think that's something that, and people have gotten more educated because they had time stuck at home. They've gotten more educated. Now we started the podcast really because we did a bunch of Zooms live with the doctors while everybody was on lockdown. And we had so many people saying, this is so helpful to learn. And I look back at, and that was 2 years ago, maybe almost. And they're
what, the early podcasts?
No, our early, our little Zoom lives that we were doing. We were doing the quarantine with LJC. So it was a quarantine, we'll spill the tea on this topic or that topic. And, I look back, I'm like, oh my God, because the podcast is now way better. But, it's all good. But I think people are doing more research on their own. And that's good, and that can also be bad because there's a lot of crazy stuff out there. So certain things you want to, get your information from good places, but at least you're kind of priming yourself with some good info so that when you have that consultation with the provider in the med spa or with the plastic surgeon, that you've really got everything you've already kind of learned about it a little bit, and then you are kind of, again, being that more savvy consumer.
I only got, out of all the comments from my breast augmentation, I got 2 bad ones. One of them was, why didn't you start with your face?
Oh, my God.
Remember that? And then the other one was interesting. It said, how could you be so selfish and do that when you're sending a daughter to college or something? So I just wrote back, you know what, Evan's fine. And better, if I'm a better person and I feel better about myself, I'm more confident, I'm a better mom, I'm a better friend, I'm a better daughter, I'm a better worker all around. It affects everything.
This is true.
Your boobs really have made you a delight.
Haven't they? I know. They are just
really good.
Oh my gosh. Look
Really
at that.
good.
I'm wearing a deep V top and I love it.
So cute.
I was the first man to see them.
Oh,
Were
he
you?
was. He saw them. He saw my naked befores.
Yeah.
Oh,
He,
wow.
yeah, he did.
You
And
brave.
I'm so brave.
You really are.
Oh my gosh, I'm so brave.
You're like the Rosa Parks.
Oh, stop it. You're crazy. All right. The website for La Jolla Cosmetic is glamfam.com. That's glamfam.com. And La Jolla Cosmetic, where dreams become real. I love saying that.
Oh, good. You sound so good when you say it,
Oh,
too.
thank you. This is Monique. Thank you so much for all
you,
your
Monique.
knowledge.
Oh, you're welcome.
You were awesome.
This
Yeah,
is fun.
it's so-
Anytime.
Oh.
You just tell me.
I could talk about this stuff all day long.
Scarily, so can I.
And it's the La Jolla
And I
Cosmetic
do.
podcast.
yeah, that's right. Come on, listen to the podcast, and I think it's just a good place to kind of get your feet wet in terms of what are the things that are out there, how do you get started, giving yourself some knowledge.
You know what? I might listen back to the one of me right before surgery because there's one of me before,
Right.
one the day of, I think,
I think it was
Or
I
the
think we
day
did
before.
a couple days after,
and then one
and
right
then
after.
when, like 5 weeks or something or 4.
I want to go back and
remember.
listen to those.
Yeah, they're good.
I
They're
know.
Really
Oh,
good. They're really
thanks.
good because you can't remember the headspace that you're in
No.
prior to surgery.
Oh, I've just been excited all around. All around. Well, Monique, thank you so much for joining our
welcome.
podcast. We really
Yeah,
appreciate
super fun.
it.
Thank you.
And we
Super
do
fun meeting
something
you.
when we end the podcast, I call it locking out. We have a phrase that we say. Will you say it with us? I'll go
Yes.
first.
Okay.
Love your podcast.
Love your podcast.
Love your podcast.
I love you, my sweet babies.